You may not have paid attention 35 years ago when public health organizations were warning women about the silent thief, weakening your bones. But now, you may know someone who has thinning bones, or weakened bones, or fragile bones. Sadly, some may have already broken a bone. On previous Inside Scope podcasts, we've had guests talk about arthritis, knee replacements, sports injuries, trauma, broken bones, but today we're going to discuss preventing those bones from breaking, specifically by arresting that thief that might be silently taking calcium out of your bones. I'm Dr. Daniel Haight, host of Lakeland Regional Health's Inside Scope podcast, and with me today is someone very familiar with bones and osteoporosis. Kelly Moores is a physician assistant at the Lakeland Regional Health Grasslands campus and lends her expertise to the Bone Health Clinic within our orthopedic department. Welcome, Kelly. And I think nationwide, we're seeing more of an emphasis on bone health and more clinics that are focused on bone health. Why is that a priority here at Lakeland Regional Health?
Well, we recognize just how common osteoporosis is and how significantly it affects our patients. We know that 1 in 2 women and 1 in 4 men over the age of 50 will break a bone due to this disease. And with treatment, we can reduce the risk of fractures by 50%.
It's just amazing how strong our bones are. We can take small falls, but when a small fall produces a broken bone, that sends up a red flag. It's like, wait a minute, was the bone not in the best of shape? And you mentioned a few categories there, like who tends to have bones that may be on the weaker side?
So it tends to affect, men and women after the age of 50.
Mm-hmm.
And
you emphasize men and women. This is not just affecting women only, but to a lesser extent, men can also have weakened bones for a variety of reasons.
Yes, definitely. Certainly the aging process. There's other risk factors, thin body habitus, lack of exercise.
Mm-hmm. I think what you and I were discussing earlier is one of the major risk factors is already having a broken bone.
Yes, they're very common. So, and we know once patients sustain a fragility fracture or a broken bone due to their osteoporosis, they're 5 times more likely to have another fracture within the next year.
Oh my goodness. So having it happen again, that's how common it is.
Very common. And with treatment, we can reduce that risk by over 50%.
And you're reducing the pain and the limited ability to do the things you want to do.
Sure.
And that's so important. And being able to address that. But I think it's this has always bothered me in medicine, that there's these silent things that are going on in our bodies, and I wish we knew about them. And I think we're trying to raise awareness. So the one that comes to mind is high blood pressure. Silent, stressing the heart out. And it's not until the heart starts to have trouble with that high blood pressure many years later that we start to feel it. And then we start to address it. But I think that this osteoporosis is going on silently. Tell me about the bones. The bones are something that are solid and never changing, or is there what's going on with those bones inside our body as they start when we're younger and all that?
Absolutely. So our bones are always changing. We build bone and we lose bone. When we're young, we build a lot more bone than we lose. But as we age, we don't build as much, and therefore our bones become less dense and more fragile.
So bones are constantly changing as we're growing, and I think you were saying that as we exercise and as we keep active, our bones sense that.
Absolutely.
And get stronger and stronger. But as time goes by, if we become less active, our bodies start to borrow the strength of our bones for other reasons, and they get weaker.
Yes.
And if you are listening to this and you are 35 years old, otherwise, things are doing fine, and you may know people who are 35 and 40, what should you be thinking about now? I mean, is it too young to be thinking about your bone health?
No, I think it's a great opportunity. Start taking care of your bones now.
Even at age 35, you'd be thinking, well, what are some of the things at age 35 and even younger and older, but around that age, what are some things you should be thinking about when it comes to your bone health?
So we talk about muscle strengthening, weight-bearing exercise.
Because the muscles are putting pressure on the bones through exercise. builds bones.
Absolutely helps to maintain their strength.
What are some common bones that tend to get weaker or cause some of the problems?
Yeah, so spine fractures, hip fractures, wrist or proximal humerus are very common osteoporotic fractures, areas where you can sustain a broken bone.
Now, I do know there is a screening test, and I'm not sure when it should be done, but there's a special low-dose X-ray that gives a general idea on how strong your bones are. What's that test called?
It's called a DEXA scan.
DEXA, D-E-X-A?
Correct, yes.
Okay.
It's also referred to as a bone density test.
Okay. So your doctor may recommend a bone density test or a DEXA test to see how strong your bones are. And I think who's going to get that conversation? Someone who's older, over the age of 50, maybe postmenopausal, maybe having certain medicines they're taking. What's a DEXA test like? If someone recommended that, it's how would you describe it as why do it?
So basically think of it like an X-ray, and then that X-ray machine has a tool where it will calculate your bone density.
Okay, it takes about 15 minutes or so to do it. And are they looking at particular parts of your body to see which parts have how dense or not as dense as they should be?
Yes. So we'll look at the lumbar spine, the lower
back, okay.
And then also at the hips.
At the hips, okay. And so sort of seeing those are part of the places where there's always a lot of pressure, and you want to make sure those bones are strong. What other risk factors do you see that, you should be thinking about osteoporosis? What are some other things other than age, postmenopausal? What other things could put you at risk?
Well, some other lifestyle choices would be smoking, excessive alcohol, excessive caffeine, poor diet, not getting enough calcium and vitamin D in your diet.
Okay. And I often see that if you have a chronic illness that you're constantly, making sure your life is in balance by dealing with maybe a chronic illness that you're dealing with, but that must also stress the bones out to make them weaker.
Yes, there's a lot of other health conditions that can tax your bones, and so you want to manage those conditions as best you can as well.
Well, I also like how you're emphasizing that when you're with your doctor and nurse practitioner or physician assistant, and you're having that health conversation. A great question is, are any of the medicines I'm taking also affecting my bones? Because you could be taking a medicine that's, helping, other conditions, but maybe throwing your bones off balance a little bit. It's important to know what are some examples of those medicines?
Well, for example, there's stomach medication that patients take frequently, and a lot of times they can get that condition under control, and changing from one particular stomach medication to another, once you've gained control of the GI condition, that can help your bones.
And I often find what's frustrating can be someone who was at risk for breaking, had already broken a bone, and then breaks another bone a month or a year or so later. I guess you're finding there's an opportunity there, and that's the importance of a bone health clinic is not only getting involved early, but it's also saying we don't want a second bone fracture. To me, a broken bone is pretty dangerous. We see people not doing well after the first broken bone and not after the second one. How important is it to get involved after the first broken bone?
Extremely important. We know that once a patient sustains one fracture due to their osteoporosis, they're 5 times more likely to have another broken bone within the next year.
And this isn't all about taking medication. It's just about understanding you have a risk, but what else can you do before you even talk about medications? It's also what helps keep your bone stronger if you've already broken a bone.
Great question. And that's what I like to, with my patients, deal with a multimodal approach. Mm-hmm. We don't want to just go straight to medications. We want to look at the things that the patient can do outside of meds that can help their bones.
Yeah, and you also just asking the patients, what's most important to you? What's possible for you? Because sometimes a recommendation of swimming, well, you may not have access to a swimming pool. Walking, you may not have a safe place to walk or it's so hot. But you're trying to get a multimodal, multiple ways that you're going to keep your bones stronger. What are some things you tell your patients about how to do some of those things? Because it's everyone's unique.
So first thing is exercise. And we need to take into account, these patients may have other conditions that prevent them from going out and walking, arthritis in the knee or whatnot, don't have access to a pool. So we can come up with an exercise plan that's safe for their bones and also takes into account, there are other factors that may limit their exercise.
Yeah, and that's that concept we're hearing a lot about called shared decision making. It's you're providing the expertise, but we're also asking patients, come prepared. Think about what's most important to you. Share that with the medical team. Share that with your physician and physician assistant, and be able to say, this is the things that are important to me. And then it's a shared decision where you're providing the expertise. And then also, I guess you have that, that ability to answer the questions. What do you think some of the, what in your experience has been some of the common questions that families and patients come with?
Well, families are very interested in wanting to keep their loved ones safe. So, how can they improve the situation around the house to help prevent falls?
Well, that's a funny story because, you live in a house all your life, and, that carpeting or that corner of that table has been there for 15 years. But when you come in with fresh eyes and you see someone's home and you look for these hazards, that's a good to point out. You may not see it yourself. We often, sometimes, I don't know if you ever have a patient do this, is bring some photographs of the home on your phone and show me. And in the clinic, you can show your provider, well, here's you got 4 steps going up into the front door. You've got 3 little dogs that could tangle you up, cause a trip and fall.
Yes, absolutely. So I haven't seen photos yet. I definitely would welcome that. But we talk about those things. Patients have stepped over the same bathtub for 40 years. Well, now it's time to go ahead and make sure there's a grab bar.
Oh, putting a grab bar in and making sure it's done safely, make sure it's done sturdily. We're talking about building bones. I wanted to talk a little bit about building confidence, because once you've fallen, you can't get it out of your mind that I don't want to fall again. Now I might be worried or scared, and I might change what I used to like to do. I used to like to go out shopping or walking in the park or going out, and now I'm not as confident because I've had a broken bone and I'm recovering, and I'm almost doing the opposite of what you're saying. I don't want to be more active because I could fall. So how do you turn that around? How do you build not just bones? How do you build confidence?
So again, coming up with an exercise program that's appropriate for that patient.
Mm-hmm.
Work on balance, strength, gait training. There's senior classes in our community that are available to patients as well.
Well, I think for some of our viewers, I think you're making a couple good points. Is that you today, no matter what age you are, could be doing things for your bones that are going to help you 10, 20, 30 years in the future. And then you may know somebody that's going through this and is suffering from a little bit of lack of confidence, and we need to, be able to support that. I've also found that I don't like talking about fall prevention. That seems sort of negative. I like what you just said. It's not about fall prevention. I would almost want to ban that word, but not fall prevention. It's what you just said. It's the balance, strengthening, and that sense of being able to have that flexibility. Tell me more about that, because those are the terms I love to hear. Say them again.
So balance, gait training.
So gait training would be, walking when you're having a little trouble walking. Let's make sure you're doing it the best and safe. That builds the confidence up.
Absolutely.
And I think the balance, there's a lot of things that affect balance. You might be on a medicine that makes your balance a little off. Let's talk to your doctor about alternatives. You may have an inner ear problem that causes a little dizziness.
Mm-hmm.
The flexibility, you mentioned some of those programs. Do you ever have a favorite one, like Tai Chi, which is sort of a way of stretching and exercise? Is there any favorite ones you'd like to recommend to your patients when it comes to flexibility?
Well, there's a local class called the Bone Builders class, and it's put on by seniors, for seniors in our community, for the purpose of developing osteoporosis safe exercise.
And I can almost say that it's a social thing too.
Some of my patients like it. They
They like
do socialize and exercise.
exercise and socialize.
The other patients go and learn the exercises they can do, learn them safely, and then take them home and do them.
Doing it at home. And that's, again, building that flexibility, building that confidence. So now you're building bones, you're building confidence, you're staying active and social, and you're doing those things to keep the bones strong. Now that's a great package to help, keep the bones stronger. But we do go back to this basic thing of your bones are constantly being made and they're constantly being borrowed from, and that makes them weaker. That must have a strategy for how medicines work. What are some of the medicines when the exercise and the other things are good, but we want to tip the balance more in the favor of the bone being stronger? What are some of those medicines generally do?
Sure. So we have medications that help speed up bone building, and then we have medications that help you hang on to bone. So I call them bone builders and bone savers.
Perfect. And I think that's another great opportunity to talk to patients, because they'll have questions. Well, what are the benefits? And obviously not to have a higher chance of breaking bones. So that's beneficial. They'll want to know about side effects. They'll want to know about costs. They'll want to know how long do I need to take these medications? Any comment? And I almost also ask, what are some of the things you want the patients to ask you and the family? Like, what are some of your favorite questions? Like, I'm so glad you asked that question, because that's what I want. Come prepared. Prepared.
Yeah. So I really like to talk to patients about their risk versus benefit of treatment. If we do this, with good diet, exercise, and medications, we can drastically reduce the risk of fracture.
Mm-hmm. And you mentioned earlier, if you're smoking, try to cut down or stop smoking, because that can weaken the bones. Excessive alcohol use. So right now, the recommendation is no more than 1 drink a day, and so that's an important bit of information to factor in, and at least understanding that can weaken my bones. But how much activities you do? Do you have any good? What are some of the good questions folks ask about medications when it comes to risks or benefits?
Sure. Well, they want to know, how is it going to help them? But then many patients are concerned about potential side effects, and we'll go through those as well.
Mm-hmm. And it's actually the flip side around too. Somebody might have needed a medicine. One common medicine that's used is steroids to treat certain conditions. I bet that's on the top of the list of weakening bones,
Yes.
So they've already gone through risk and benefit. They needed that medicine to help whatever condition they had, but they also realized they need to now pay more attention to their bones. And some of those medicines that reduce the acid in your stomach, there's alternatives, but some of the stronger ones, they might have a role weakening bones. Yeah, I think that's a key thing. With men, is it often men who are on the lighter side, as far as weight goes, that they may have weaker bones?
Yes, I think this is probably the one condition that I know of where being on the thin side increases your risk.
Yeah, exactly. And also, you're located at the Grasslands Clinic there on Hardin and Edgewood. Whoa. Tell me about the team there. You're tied in with the orthopedic group there. And who else is working around you that's really making the experience well-rounded for the patient?
Sure.
I know, starting from the receptionist on back.
Absolutely, yes. So our team is, pretty well versed on the bone health clinic and the importance of helping patients, keep their bones strong and prevent fractures. My right-hand man, if you will, or works very closely with me, is David, one of our nurses.
Mm-hmm.
And he can really help patients with questions outside of the clinic, with medications and pharmacy benefits and things, along those lines.
Yeah, and now with a patient portal, you can message and get some questions that came up after you had a visit. So that's a big benefit. And you're really connected with the other doctors, because some folks have very complicated stories that are involving bone health. So you have rheumatologists nearby. You have endocrinologists, which is the doctors who deal with sort of the internal chemicals of our bodies that our glands make. Any other part? Well, I guess primary care and such. And
Yes.
Raising awareness that there's bone health priorities. And sometimes if you while you're waiting for the appointment and getting it all lined up, that gives the chance for folks to do their own research. And any particular areas you find that are helpful in getting information so that you come prepared for, the bone health clinic?
Sure. I'd like when patients come in with questions and specific, concerns, so that we can address them. There's, there's plenty of information on the internet. There's a Bone Health and Osteoporosis Foundation that has great resources for both patients and professionals.
Because I find that, like listening now, I'll remember some of this. I can't remember everything, but then if I read a little bit, I saw a little bit, experienced it, talked to someone who's an expert like yourself about the bones, it starts to sink in. But I always tell patients, don't worry if you don't remember everything. It might be the third visit, the fourth visit, it clicks, and you're like, it's coming together, and you're really feeling that I'm a part of my health, and I'm sharing these decisions, and I feel good about it. I really appreciate your expertise and all that, because there's so much going on, and we're seeing bones breaking that could have been prevented, and it could have been prevented not necessarily with medications, but with just all those diet, exercise, and if needed, medications that will keep those bones stronger. What were the two categories? You had medicines that help build the bones,
or I call them bone safe.
And because we do see how the bones can be borrowed from and all that, and we sort of call that the silent thief, right? I remember for many years ago doing that. Well, I appreciate all your expertise in the area, and there at the Grasslands Clinic, I thank you for everything that you're doing.
Well, thank you.
Great. Let me know if you need anything, and this is going to be, I think, a very, very important topic, and then folks are going to ask about, is it time for a DEXA scan? Oh, I wanted to ask that. What DEXA scan? When should you consider that it's that X-ray that allows you to know how strong your bones are?
Sure. So the guidelines call for obtaining DEXA scans at 65 years of age for females or 70 for males. But I want to emphasize,
or if you had a broken bone,
absolutely.
It's like, well, that was all. Let's find out what your density is, and that says, okay, this is mildly diminished. Let's look at the exercises and diet. But if it's significant, they could say your risk of having another broken bone just through daily activities, you might need to be more aggressive in the treatment. Well, I know you have that wealth of information, so I appreciate you being there. The Bone Health Clinic, folks can just ask for that.
Yeah.
And I think that would be great to meet your team, the radiologists and everyone you work with.
Thanks a lot. Thank you.
Yeah.
Appreciate it. Thank you.